Good morning. It's the day of my surgery, April 10th, and it's 5:15 in the morning. Didn't sleep too much last night. By the time I got through doing all the stuff I had to do, it was 12, and then I slept till about 3 and then I had to go to the bathroom. I'm a little thirsty, a little bit hungry, but otherwise I'm doing okay. The wash that I used last night, the wipes that they have you use, made my skin a little itchy. It talks about if you're allergic to them, I guess don't use them. I don't know what they want you to do, but I didn't know I was allergic. So, but I do have atopic dermatitis sometimes, so a little itchy. But I'm going in for my right knee, and this is how it looks now. It's only slightly swollen compared to my left knee. And I guess I'm good. I'm supposed to be there at 5:30, and my hair is wild because I didn't use hairspray because they didn't say I could, so I didn't. And I guess that's it. So I'll see you on the other side.
I'm going to pause here for a moment to let you know that I don't have pictures or video of myself in the hospital from the time I arrived until the time I was out of the recovery room. First, there wouldn't have been time to do it, and secondly, I don't think they would have allowed it because it would involve taking pictures of people who had not given their permission. So to fill the gap, I will just tell you what went on during that time, but I have pulled some pictures from the internet to kind of illustrate the story. A few of the pictures are of my hospital, but for the most part, they are generic pictures of hospital rooms, doctors, nurses, um, a, surgery, and even a patient. None of these are of me or of my doctor and nurses, but I wanted to give you a sense of what went on. So let's continue. We drove to the hospital and got there at 5:30, just as we'd planned. That's 5:30 a.m. The sun was just starting to come up. The hospital doors don't open until 5:30, so there was a little bit of a line waiting outside to get in. I remember thinking, who knew this many people got surgeries all at the same time early in the morning? But by the time we got parked and walked to the doors were open and we went inside. As we walked down the long corridor, I must say I felt a little trepidation. I had been here before, though, to do the pre-admission. I knew where to go, and as soon as we got down, they told us to go down past the planter with the green plants and turn into the waiting room for surgical admissions. And so we did that, and as soon as we got in there and got busy, I was fine. Again, there were quite a few people there, but it was very organized. They took us pretty quickly, reviewed the paperwork that I had already submitted, checked my ID and my insurance cards, and asked for my advance directive. I had to sign a few things. It didn't take too long to finish all of that, and it wasn't long afterward that they called us and told us to go to the elevator and go up to the surgical floor. When we got off the elevator on the surgical floor, they took us to a pre-op room, which was an actual room, not a curtained off area. It had its own bathroom. There was a hospital gown on the bed. They asked me to change into the gown and use the antiseptic wipes again to wipe myself down, and the wipes were already in the bathroom. So I did all that. I was hesitant about using those wipes again because it kind of made my skin a little itchy, but they said, that's okay, don't rub or anything, just wipe. So I did that. I put my belongings in a bag that they gave me. I put my clothes and my cell phone in there. And when I came out, I gave them the bag and I got on the bed. Next, a nurse came in and started the IV. This was the only thing that actually bothered me. I do not like getting an IV. But it was done, and I was glad it was over. I still worried a little bit about getting the spinal. I had never had a spinal or an epidural, and I was nervous about that. Little did I know then that I wouldn't remember a thing. I'd like to interject here that hospitals have changed dramatically since I was a candy striper in the 1960s. They It's hard to believe, but you can almost say they've become welcoming places. Every single person I encountered, every single one, was friendly and helpful and smiley, even at this early morning hour, from the people in admissions to the nurses, the doctors, everybody. They just were so pleasant. And it really helped to take away the anxiety because I was having a good time talking to people. We were joking around about various things, and it was very pleasant. And it did take my mind off of feeling anxious. So that aside, like I said, it's a big difference over the years. And I had not been in a hospital as a patient since I was like 6 years old. So big difference. Anyway, for about the next hour or so, I was in that pre-op room and many different people came in. There were multiple nurses checking vital signs constantly. I was hooked up to the blood pressure monitor and all that stuff, and so they were checking all that. Um, the nurse practitioner came in. I'm familiar with her and had met with her several times. And everybody that came in asked the same questions. When is your birthday? Do you know what you're having done today? Do you have any questions? Which leg is it? I mean, they just kept going over and over the same thing, asking my name, my full name, just checking my wristband that, had my name on it now and important information. So um, each one came in one at a time and talked to me, the nurse practitioner. She asked the same questions. She asked which leg it was. Of course, they knew, but they're verifying. And when I told her the right leg, she took out a Sharpie and she marked my leg, signed her name to it, her initials. The anesthesiologist came in and we talked. I wanted to make sure that she knew that I had lost a few more pounds since I had been in for pre-admission. So I wanted to make sure everybody knew my weight so that I was going to get the right amount of medication. Then the doctor came in and we did a fist bump and I chatted with him a bit. I told him that I had a friend who I'd spoken to just a few days before who had had knee surgery and had a bad experience. It wasn't with him, it was another doctor, and that she had had problems with a nerve that had been compromised. And I told her the name of the nerve, which I don't remember anymore. And I said, now, what are the odds that that's going to happen to me? So we talked about it a little bit, and I said, okay, just be very careful around that nerve. I don't want any problems. He said, yeah, he would promise, and it was all good. So, yeah, did all that, and um, it was very pleasant. So after they got through checking and rechecking everything, putting everything in my chart, um, a nurse came in and put something in the IV. I'm pretty sure, I can't remember now, but I think that was an antibiotic. And I told her at the time, now I want to know everything you give me when you give it to me so I can be aware of what's going on. And she said, "You want to know everything that goes in?" I said, "Yes, everything that goes in." And I know she was probably thinking to herself, this gal's not going to remember a thing about any of this, but she said, "Okay, that's what we'll do." And so and I told her, I said, "Listen, I have never had any serious drugs, and I've never even had any alcohol, not a glass of wine, not a beer, no alcoholic beverages ever. So my body isn't going to know what's hit it when it gets all these drugs. I have had colonoscopies, outpatient colonoscopies. So I'd had propofol, but I hadn't had anything else. And I said, so um, I don't know how I'm going to react, but just know that my body is not used to this stuff. So anyway, I think the next thing she did was give me the Versed, which again, I've never had. And then at exactly 7:30, which was my surgery time, a bunch of them came in. I think my doctor was in there. I think my anesthesiologist was there. I'm not even sure, but they came in and unlocked the stretcher and took me to the down the hall to the operating room. I remember being wheeled down the hall and thinking, "Oh, we're going pretty fast." And then I remembered thinking, "They gave me something in the IV, but I don't feel a thing. It hasn't even made me sleepy." Or they said it'd make me relaxed. It doesn't make me feel any different. I feel exactly the same. And that is literally the last thing I remember. I never saw the operating room. I imagine it looked something like this. And yet, I say I never saw it. I did. And I was awake, or so I'm told. The doctor had told me before this, when I'd met with him prior to the surgery, you have to be awake. Because I said, can you put me out before you give me the spinal? He said, no, you have to be awake so you can sit up, bend over, and get in the proper position to get the spinal. And I was disappointed that I couldn't be asleep. But he said you won't remember it. And I did not believe that. How can you not remember it if you're awake? So after the surgery, or in my follow-up visit a couple of weeks later, I said, "Was I awake when you did the spinal?" He said, "Yes." I said, "Are you sure?" He said, "Yes, you were." I said, "Man, I don't remember a thing." I was rolling down the hall again. I felt motion, I felt vibration, and I don't remember, but I suppose they were probably calling my name, maybe saying, "Wake up," because I do remember saying, "Is it over?" So they must have been, telling me to wake up and that it was over. But I just remember saying, "Was it over?" And they said, "Yes." And that's it. I remember going one direction, and then I remembered coming back the other direction. And they took me to the recovery room. Once back in the recovery room, I woke up pretty quickly. I looked around, watched the monitors. I like to see what's going on, so watched my blood pressure and my pulse ox and all that, and everything looked good to me. And I was pretty alert. I was watching people being brought in, coming and going. Funny thing was, it was pretty quiet. I think I was the only one awake for some reason. I do tend to wake up pretty quickly after colonoscopies, so I don't know. I was awake, but I heard them coming in to try to wake other people up, and it took a while to get others to wake up. But anyway, I was alert, talking to the nurses. At one point, a helicopter landed on the roof, and they all went over to see it, and they were pulling my curtain back so that I could see it too. I didn't see it because I wasn't in a good position. But anyway, we were just you know, chatting and watching what was going on. It wasn't long after I woke up that they took the oxygen off, um, although they left the IV to my disappointment. Um, and again, were people coming in and out, and I was on a machine. A machine was on my legs, squeezing and releasing, squeezing and releasing. It wasn't uncomfortable. It felt fine. It was kind of like a blood pressure machine. It would do it every so often and felt good. Well, at first I didn't feel anything because I still had the spinal. And that was kind of weird. Like I would put my hand down by my side and feel my leg, my thigh. I couldn't feel a thing. And I mean, nothing. And then as time went on, I could feel it, but it didn't feel like my leg. I could just feel a little something, but it didn't feel normal. And then as more time went by, I could feel a little bit more. But before I could, um, when I still couldn't feel a whole lot, I was starting to regain some feeling. The doctor came by, or the nurse practitioner, I'm not sure, someone did, checked me, checked where I had feeling and, where I didn't, and asked me, I was lying down, so they asked me to move my feet. And I said, "Oh, I'm trying, but I can't." And they said, "Yeah, you are." And I looked down, and yes, my feet were moving. And then they said, "Can you move your legs?" I said, "Oh, really trying, but I can't." They said, "Yeah, you are. You're pulling your knee up." I said, "Oh my gosh, my other knee." I don't think I was pulling up the one that had been operated on. But I wouldn't know it if I hadn't looked at it. I just couldn't tell what I was doing. So, but everything apparently was okay, and little by little, the sensation, the feeling in my leg was coming back. But I kept checking in my head to see where the pain was, because I figured, okay, feeling's coming back. I must be gonna have some pain here. And they ask you constantly from the time you wake up, what's your pain level? 1 to 10, what's your pain level? And I kept saying, 0, 0, I have no pain. And they would say, what's your pain level? Do you want some medication? No, 0, I have no pain. So I kept waiting for that to happen, for there to be some pain, because they made me think like there should be. So, but never did. And by that point, it had been probably, I think I woke up at about 2 hours after I went into surgery. So probably about 9:30. Maybe I was in recovery 45 minutes, an hour. It seemed like it was close to 10:30 when I left there. And, they kept checking me. Everything was good. And so they took me back to, by that point, by the time I left the recovery room, I think I was feeling, uh, able to feel my leg again. And it was bandaged and had a support stocking on, I believe. I mean, it looked big. There was a lot of stuff there under the cover. And so they took me back to a room similar to the one I was in before, uh, in the pre-op room. It was similar to that. Small, but an actual room with a bathroom. And that's when my family came in. There had been some mix-up for the families. They have your cell phone number and they give you updates when the person's in surgery. And I think there's a board with your name or number and the update. But there was some confusion because initially I'd planned to stay overnight, but a few weeks before I changed it and said, no, I want to do it all the same day. And somehow there was some confusion about where I was. They knew everything had gone okay, but they didn't know what room I was in. Finally, they got to the pre-op room, and that is where the video picks back up. Just a quick note here. I talk a lot about thinking I was asleep, but being awake. I was awake for the spinal. I don't remember it, but I was awake for the spinal. But after they give you the spinal, they do put you to sleep. I was not awake for the surgery. So just a point of clarification. And afterwards, I went to the post-op room. I think I said pre-op, but the post-op room. And that's where we get back to the rest of the story on video.
Hi, here I am in recovery. Well, I'm not in recovery, I'm in post recovery. Getting ready to have physical therapy. I can feel my legs. For a while, I couldn't feel them at all. And I am not having any pain. I'm starting to feel a little bit of sensation, mostly in the back of my knee. It feels muscular. I had no pain. They kept saying during recovery, are you feeling pain? No. You feeling pain yet? No. But I have a nerve block, but the epidural has worn off, and obviously all the anesthesia. So I'm awake. My blood pressure's good. I've been to the bathroom. And so they've gone to get the physical therapist. I'm going to get dressed and I got to do that. Walking in the bathroom, I didn't want to put too much pressure on the leg. It didn't hurt necessarily. Oh, there goes my blood pressure. It didn't hurt, but I just didn't want to put too much pressure on it. I was able to sit down fine and get up fine. And so, yeah, I'm good. And I will talk to you later. Hi, I've had my physical therapy. I'm still in the hospital. I did the stairs, I did the walking, and I haven't had any pain meds other than I have a nerve block, which is significant, but I didn't have the oxy. I'm sure I will start feeling, the only thing I feel right now is I feel like the muscle, like when you not pulled the muscle, it's not that bad, but like you've a little bit of soreness in your muscle right in through here. But it's barely noticeable. It's just that I finally have some sensation there.
Okay, everybody.
Okay. Yep, we're finishing my vlog. Hey, so we got interrupted before, but I'm now home. No problem getting home. Still haven't had any oxy. And I did my PT to learn how to do the stairs. And we're gonna try it out. So here we go. Go up with my left leg. Is this right?
You go.
I'm in the cane in this hand.
Yeah, but your cane's supposed to move.
I don't know if you need the cane at all.
I don't think I do, but
They had her practice
they
with it
told me
though.
to do it that
Yeah.
way. So
Okay.
we're gonna do it. I'm being a good little girl.
Yeah.
For a while, I told Emily I could just as easily do like I used to do and go sideways and hold with both hands on the rail.
And I'm right behind you, so if you fall, we'll
We're
both go down
going
together.
down. Yep.
You're gonna go into
I
the
don't even
other.
feel anything right now.
Well, that's because the
Yeah.
Well, I'm not bending. It was a nerve block.
The nerve
but I'm also
block.
not bending that knee.
which way are we going?
We're gonna go in here, and I need the walker
I'll bring the walker up.
or not. Let me just hold.
Oh yeah, that's right. You need the walker to up here.
Wait just a second. Just turn it.
Oh, I'm sure. Okay, you need an arm.
Do this.
Pretty sure they said at the hospital not to do what you're doing right now.
I know.
Only use the walker. But you're a little rebellious.
Go back up to the chair.
Feel it with your
I'm gonna drop
legs.
this so nobody panic. Feel the chair. And I should put this leg out, but I'm gonna try bending it. There. All right, thanks, bye. Hey, I'm home. It's been over an hour, so I'm doing my walking. I'm supposed to walk for 5 minutes.
It's been over 5 minutes
been over
because she's
5
an
minutes.
overachiever.
Yeah, but I'm doing some walking. Hi, Chris. And I can even stand by myself, which I'm not supposed
She's not supposed to do that.
And my leg has, did I show the leg yet? I don't think I did.
I don't think you're supposed to be doing this either. Pretty sure.
So there's that. Can't see anything, but there it is. It does look a little full.
A little swollen.
Okay, and now they want you, I had read, they didn't tell me this today, but I had read they want you to at least be at 90 degrees when you leave the hospital. So we're going to do a check with my math teacher daughter to tell me what degree I'm going to bend a little more and tell me what you think.
Well, you're almost at 90.
I just,
You're.
that was more than 90.
I'm just looking at the angle that this is making back here, right?
Yeah.
So that's a little more than 90. That's pretty close to 90.
Straight, I don't know how straight I can get.
Yeah, it's hard to tell too what's straight with all the
Let's
bandage.
say right there, what would you say? Close?
Yeah, probably pretty close. Yeah.
Okay, so we'll walk a little bit more toward you. And still not hurting. I'm going to take Tylenol just because it's time to take it. But still not hurting. I don't need it, but I don't want to let it all of a sudden wake up in the middle of the night and say, I should have taken something. So I'll take the Tylenol and then we'll see tonight what I need. All right, bye. Okay, hi guys. It is evening. It's about 7. I'm gonna have dinner. I had a lunch. What did I have for lunch?
You had the roast, but it was
yeah,
a very late
crock-pot
lunch.
roast.
Yeah, like 4 o'clock or
Late lunch,
3:30.
and I'm getting ready to have dinner with some more Gatorade. I don't think I'm drinking enough. I've been blowing into that spirometer.
No, you've been sucking on it.
I've been sucking on the spirometer, and I pretty much can max it out all the way to the top. I really think as long as I'm up walking, I won't need that too much.
Where
but
you want this in the yellow room?
Yes.
yes, please. I'm gonna take
Sorry to interrupt you there.
Yeah, I just need to keep moving. I won't need that too much, but I will use it for a while. So I've been walking every hour, kept ice on, kept elevated. I'm getting I have quite a bit of swelling. I think it's been there since the operation. I have quite a bit of swelling. You can compare the two knees. I'll try to show you tomorrow. I haven't taken anything. I haven't taken any Tylenol. Got the Celebrex, and I've been icing, but I haven't taken any Oxy, and I haven't taken any Tylenol. With dinner, I'm going to take the Tylenol. I think I'll take half an Oxy at bedtime. She said you can divide it. And then I'll have some by my bed. I can take up to 2 at a time. So I'll have some by my bed to have if I wake up and need it. Tomorrow's supposed to be a worse day. I am feeling a little bit of discomfort, I guess you'd call it. It's really like a sore muscle and nothing more. I mean, a lightly sore muscle. Like instead of walking my usual 2 miles, I would have walked 3 miles to have felt that slight soreness. And it is the thigh above the knee, and it is below the knee on the outer part of the calf. I feel it more when I've got my leg elevated, but when I'm standing up, I don't feel it so much. And when I have to do the foot pumps, the quad flattening out my leg, and glute presses, or whatever you call it, tightening. When I was doing the foot pumps, I felt it, I got like a shin splint on this leg, but walking now I don't feel it. So it's all been muscular so far. I'm sure tomorrow will be different, so I'm getting as much walking in today as I can. And my last walk and this one, I've been able to walk without much of a limp, alternating legs and without
Are you
much
going
of
to
a limp.
demonstrate?
So I'm going to demonstrate that. I may have to start off limping, but it will get better. Oh, I do feel a little, especially when I'm walking like this, especially if my leg goes back very far, I feel a little bit of a lock in my knee, but not the kind of lock you have when you have a bad knee and it locks up on you. It just lasts for a second. I'm wondering if it's something with the mechanism, clicking into place. It may also be they had to, because my leg flared a little and they moved it back. There was a ligament or tendon or something here that was stretched out, and it may not be holding that well in place right now. It's nothing to worry about, but I just momentarily will feel that lock. All right, I think that's it for now. I'm gonna go have dinner. My appetite's pretty much normal. I had a little crackers and cheese and stuff in the hospital, a little bit of crock pot roast, and now I'm gonna have some Parmesan chicken and some green beans. Still trying to maintain the diet, but try to eat enough protein as well. So that's where we are today. See you on day 2.